What is rehab? Rehab is training in the presence of injury. It shouldn't look that much different from a regular workout that you would perform in a gym. Rehab is all about finding ways to stimulate the tissues that are injured in a safe but challenging way. I emphasize challenging because you need a certain level of stimuli to trigger the body's response to get stronger, to trigger those tissue adaptations that we're looking for. The stronger you get, the more resilient you get, the less sensitivity to pain you feel, the more confident you feel, and the quicker you'll be able to go back to work. Now, intensity is a very important thing. When it comes to intensity, I like to use a scale rating from 1 to 10. 10 is the hardest thing you've ever done, and 1 is basically doing nothing. The intensity that I'm looking for in rehab is about a 6, 7, 5, 6, 7. Anything below that 5, 6, 7 mark is not challenging enough to create any tissue adaptations. Anything above that range is a little bit too much and you run the risk of injury. Now, 5, 6, 7 is usually how hard a stress session should feel. And this also applies to regular workouts in a gym. That's the intensity you should be striving for. In our clinics, you will be able to have a professional with you, making sure the exercises and the environment is safe so that you can push yourself every single session. But yes, that is basically what rehab is, training in the presence of injury. I have a shoulder pain. Let's just say I can't perform overhead presses. I will find ways to challenge that shoulder. In this case, keeping it below the shoulder line. So I'm not going to take overhead, but I can find multiple ways to stimulate or stress that shoulder without having to go overhead. I can do a lot of push movements. I can do a lot of pull movements. I can do some single joint movements for that shoulder. But the key is it has to be challenging enough to create that tissue adaptation. The very light stuff is okay for the first week or 2 or even 3 sometimes, depending on the severity or how acute your pain is. But after that, it should move to more challenging things. And like I mentioned earlier, the stronger you get, the more confident you feel, the more robust, the more resilient that joint becomes. And the more muscle you develop around that specific joint, the stronger that joint gets. The more those muscles are the ones taking in the load rather than the actual joint per se. And that applies to a soft tissue injury. If you pulled a muscle or you rolled an ankle, and like stimulating or stressing those tissues specifically in a safe way will allow those tissues to remodel in a healthy and efficient way for you to be able to get back to work. And yes, that is what rehab is.